Hello everybody, it's Dr. Seb from tmjtreatment.com, and today I wanted to talk to you about why the flat plane night guard, the most prescribed night guard all around the world, may not be the best option for you if you are suffering from temporomandibular joint dysfunction. Before we go further, I'm a general dentist with a practice limited to treating patients with temporomandibular joint dysfunction, snoring and sleep apnea, and functional orthodontics in London, Ontario, Canada. In order to understand why something is not working for you, why I'm suggesting that, let's review the design. If you look at your screen, you'll see what I mean by a flat plane night guard. This is oftentimes a night guard that goes in between the teeth. It can go either on the top or the bottom, and the purpose of it is to protect the teeth. You see, in dental school, we were taught to make one of these for our patients suffering from headaches, suffering from a sore jaw. But the problem here is that we were too focused on protecting the teeth. We were not perhaps looking at the underlying root cause of the problem. Most of my patients, and I see about 100 TMJ patients in a week, I can see the pattern now. And the pattern is that this doesn't help most of our patients. The reason for this is because it actually promotes the clenching. It doesn't stop the clenching. Maybe you were giving this night guard, you had some symptoms, and perhaps either it didn't improve your symptoms or actually made it worse and you stopped wearing it. Now, when a patient comes to me and I take a look at their night appliance, almost all the time, this is the situation that their night appliance is in. As you can clearly see on the screen, this patient has made significant holes or wear or divots on their appliances, indicating to you that they're actually still continuing to clench and grind. So this really begs the question, if the patient came in with the initial chief complaints of clenching and grinding, and we see these signs on their night appliance, is it really stopping the clenching and grinding? Is it really helping the symptoms? And I can confidently tell you that it's not. The other thing that I often see is a situation where the patient is in stage 2 of internal jaw problems. They got a clicking jaw, they got pain, and they got intermittent locking, which means they can only open one finger's width. If a flat plane night guard is given to them, because the flat plane night guard causes the lower jaw to go back, if you're in stage 2, I have seen many times where a flat plane night guard is going to take a patient from stage 2 to stage 3, which is chronic closed lock, which is a situation where the patient can barely open. It's a very painful condition, and now have to be referred to a TMJ specialist to get the care that they need. Lastly, what if a patient has snoring and sleep apnea and we don't check for that and we give them a flat plane night guard? If you take a look at your screen, there was a study that was done where patients verified to have sleep apnea were given one of these night guards. What happened was the patient's AHI score, which is a way to measure sleep apnea, became 50% worse. So if you had mild sleep apnea, with the use of a flat plane night guard, you would end up having moderate sleep apnea. So the concern here is that the flat plane night guards causes the lower jaw to go back and causes a narrowing of the airway, which could make the situation for a patient with snoring and sleep apnea worse. So we have to be very careful on who we prescribe these night guards to. So in conclusion, both in clinical practice and also based on research, flat plane night guards are not good for a patient suffering from temporomandibular joint dysfunction, and they're also not good for a patient suffering from snoring and sleep apnea. What really needs to be done here is a proper assessment and a proper diagnosis so the right appliances can be made. Again, I'm Dr. Seb from tmjtreatment.com. I love educating you on these topics. Please share and leave your comments for me below. Take care.